Good morning. Thank you so much. Thank you, Dr. Diaz. Thank you, Mosa. Thank you, Jean, for those incredible comments. I am humbled and honored to be here today, and my remarks are going to skew a little more personal, blended with the professional. I am an Afro-Latina first-generation Bronxite. I am the daughter of immigrants who came in the 1940s from Cuba in search of the American dream without the opportunities for education that they were able to bestow on me here. When I think about my adolescent self, I think about the opportunities that the Adolescent Health Center gives to youth who may have been like me. When I was 17 years old, my mother, Delfina, suffered a significant psychiatric break. She became depressed. She developed psychosis. She was never the same for 40 years. So by January of my senior year of high school, I had a mom who was well. By June of that graduation, I had a mom who was hearing voices and who never quite recovered. A mom who understood the stigma, had internalized the stigma around mental health. And one of the reasons she didn't recover was she refused to seek help because the stigma was overpowering. I myself, although I struggled to get her the help that she needed, I myself internalized that stigma in some ways. I didn't understand, my 17-year-old self, that the preservation of mental health was more than the prevention of psychosis. And so I love that the Adolescent Health Center incorporates mental health as a component of health and well-being. I got an up close and personal view of stigma when society tells you you are less than, when society told my mom she was less than. As you heard from my bio, I practiced HIV, AIDS. I'm a primary care internist by training, but most of my clinical career was in HIV, AIDS. I am the first generation of physicians to have graduated from medical school and practiced at a time when HIV was always part of my practice. When I was in medical school, we didn't have a name for the virus yet. The virus had not been identified. But my oral exam was actually seeing a young man who had PCP. As a young physician in San Francisco in the 1980s, I got to see up close and personal how stigma, how societal stigma told people that who they were, how they identified, who they loved, who they had sex with, how they had sex, was all wrong. Where not only did society say these things in terms of its quote-unquote social norms, but we passed legislation in many instances. We passed regulation. We tried to criminalize people. We tried to jail people. I got to see up close and personal how stigma affected the most intimate decisions that we make. Intimate decisions about love, intimate decisions about family. And now fast forward, many years later, I'm at the Guttmacher Institute, a think tank that focuses on sexual and reproductive health and rights, at a time when sexual and reproductive health and rights are at incredible assault in this country, where the Supreme Court forecast, not only was it rolling back the federal protections against abortion, it forecast in its own decision that they were coming for all of us. They were coming for people who were LGBTQ. They were coming for people who used birth control. They're coming for all of us. where once again the stigma of who we choose to love, whether or not we choose to become parents, whether or not we choose to get pregnant or to carry a pregnancy to term, are being legislated, are being regulated, and are being stigmatized. I say this because as I think about the Adolescent Health Center, and I think about their tagline, no judgment, no charge. No charge, that's critically important for the here and now. That means access. No judgment, that's priceless. That is a lifetime. No judgment, dignity, humanity. That is what the Adolescent Health Center offers. And for this, I am incredibly grateful.